Menopause is an experience that's shared by every woman, and although it's normal for us to experience these changes, it can be quite difficult. We know that through perimenopause, we experience changes in levels of hormones, and more specifically, a reduction in estrogen. And along with these changes in hormones, we can have different symptoms or side effects that show up, and many of these can be unwanted or quite disruptive. So sometimes women can experience things like hot flashes, night sweats, difficulty with sleep, reduced bone density, increased muscle atrophy, and other metabolic changes, including weight gain. We want to make sure that as we experience this transition through perimenopause, we equip ourselves with tools so that we can come out of or experience this transition without being completely depleted or without it interfering with our quality of life.
We have some questions about menopause coming up, and I'm so happy to share about that because it is just not an area that we have enough education about. And a lot of times we enter into this period and feel like we're becoming this whole new person with a lot of different symptoms and changes with our bodies. So let's talk about that a little bit. So, menopause is when there's the absence of a period for 12 months. Prior to that, there can be some fluctuation in the cycle. So, some like spotting, some just irregularity, and that can be an indication. The most common age that it happens at is 50 to 51 years old. However, it can happen earlier, which would be like in kind of like mid 40s, would be early. The most common symptom early on is night sweats, as well as hot flashes. So, those are really common. Others of pelvic symptoms, because you have a drop in all three of your sex hormones, it becomes drier in that area. So now intercourse can be a little bit more painful. You can lose muscle mass in those pelvic floor muscles, which then can lead to other pelvic floor symptoms like urinary incontinence, weakness, things related to that. But with all of these changes that are not fun, there's a lot that we can do about that. So, in terms of the pelvic symptoms, we treat those things all the time. So, we work on strengthening the pelvic floor muscles, different lubrications. There's a lot that we can do there for osteoporosis and muscle mass. We can build that strength, we can build that bone density. From your medical provider, hormone replacement therapy early on is really, really beneficial, and there is no association with breast cancer. Now, if you have a history of breast cancer, that they might not put you on that, but there are a lot of different kinds of hormone replacement therapies that aren't all oral, and those can be really, really beneficial in decreasing these symptoms. So, I hope that this was helpful. If you have any other questions or you're experiencing some of these symptoms, reach out, come see us. Thanks.